I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Fibroids are also known as uterine leiomyomas. These are non-cancerous growths that develop within or on the uterus. They are quite common among women of reproductive age. Fibroids can vary in size, number and location, and they can have different effect on fertility based on their characteristics. Let's look at some details of fibroids, their types, and how they can impact fertility and what are the treatment options available. Fibroids can be divided into a number of types. Intramural fibroids. These fibroids grow within the muscular wall of the uterus. They can distort the uterine cavity, potentially affecting embryo implantation and leading to pregnancy complications. Then comes submucosal fibroids. These fibroids develop just beneath the uterine lining and can protrude into the uterine cavity. They are more likely to cause heavy menstrual bleeding, pain and fertility issues due to their location within the uterine cavity. Then we have subserosal fibroids. These fibroids grow on the outer surface of the uterus and may press against surrounding organs. While they are less likely to impact fertility directly, large subserosal fibroids can cause discomfort and other symptoms. We also have pedunculated fibroids. These fibroids are attached to the uterus by a stalk or by a small stem or a peduncle. They can be intramural, submucosal or subserosal in nature. What are the effects of fibroids in fertility? It can cause implantation disruption, especially submucosal fibroids that distort the uterine cavity can interfere with embryo implantation. The presence of these fibroids can create an environment which is less conducive to embryo attachment and growth. They can cause blockage of fallopian tubes. Large fibroids can alter the position of the uterus and in some cases block or compress fallopian tubes. This can impede the journey of the sperm to the egg or the fertilized egg to the uterus. Fibroids also cause reduced blood flow. Depending on their size and location, fibroids can impact blood flow to the uterine lining, potentially affecting its receptivity for implantation. They can cause pregnancy complications, especially those in certain locations that can increase the risk of pregnancy. Complications such as miscarriage, preterm labor and breech presentation also are complications with fibroids. There are a few treatment options though, such as watchful waiting. In cases where fibroids are small and not causing significant symptoms, a watch and wait approach might be recommended. Regular monitoring can help determine if fibroids are growing or causing fertility issues. Then there are medications. Hormonal medications such as GnRH agonists, gonadotropin hormone releasing agonists, can temporarily shrink fibroids by suppressing hormone production. However, this is often a short-term solution and doesn't eliminate the fibroid totally. Myomectomy. This surgical procedure involves removing fibroids while preserving the uterus. Myomectomy can be performed through various methods, including open surgery, laparoscopy, or hysteroscopy, which is especially for submucosal fibroids. Uterine artery embolization is also another procedure. It is a minimally invasive procedure. The blood supply to the fibroid is blocked, causing them to shrink, and uterine artery embolization can be effective for certain fibroid types and sizes. Hysterectomy is also another method. For women who no longer desire fertility or have severe fibroid related symptoms, a hysterectomy, which is the removal of uterus, might also be considered. This option, however, might lead to permanent infertility. Therefore, this should not be considered when you are trying for pregnancy. If you are experiencing fertility issues and suspect fibroids may be the factor, consult a reproductive specialist or a gynecologist. They can assess your condition, determine the impact of fibroids on fertility, and discuss what treatment options will work best for you. To understand more about this, please feel free to contact us. Thank you.
A lot of effort has gone into making this video. Please like and subscribe us. Thank you.